Part A. In this part of the test, you hear two different extracts. In each extract, a health professional is talking to her patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mr. Jonathan. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning, Mr. Jonathan. Tell me about your problem.
I am having severe and recurrent jaw pain, doctor. There's also numbness and tingling along the jaw, teeth, and tongue.
How long have you had these problems?
For the past 6 months, I even consulted a dentist, but the dental evaluations are normal. I was also diagnosed with a throat infection last week, and I was prescribed Avalox, which I've almost completed. I am taking cough drops and trying to increase fluids.
Oh, I see. Do you drink or smoke?
No, doctor, but I used to chew tobacco for about 30 years, but I've recently stopped.
Okay.
Moreover, I've also lost the sensation of taste. The numbness is on the left lateral tongue and jaw that extends from the angle of the jaw to my lip, doctor. Recently, I've gained about 20 pounds of weight, and that may be due to decreased activity.
Do you get headaches?
Yes, doctor, about twice in a month.
Do you experience any fever or chills?
No, doctor.
Do you have any tooth pain, especially while biting?
No, doctor.
Have you had any jaw popping?
No, doctor.
Any spasm of the jaw, that is trismus?
No, doctor. I've stopped chewing tobacco, and I'm using Nicorette gum now, doctor.
Okay. What's your age now?
50 years.
Have you ever had any surgery?
Yes, pertinent for hernia repair surgery.
What medications are you taking at the moment?
Tylenol, and I'm on Nicorette gum.
Are you allergic to any medicine?
Yes, I'm allergic to codeine. I used to feel dizzy or lightheaded when I took codeine.
Your blood pressure is 138/82, pulse 64 normal, temperature 98.3, and your weight is 191 pounds. Your oral cavity is normal with good moisture. You have a slightly decreased sensation to your left jaw that extends to the left lateral tongue and left intrabuccal mucosa. The fiber optic nasopharyngoscopy reveals a moderately deviated nasal septum to the left, large inferior terminates. You have developed persistent paresthesia of the left manual teeth and tongue, possibly neoplasm within the mandible. You have also developed hypogeusia with loss of taste and dry mouth syndrome called xerostomia. I would suggest you have a CT of your head, including sinuses and mandible, so that I can evaluate and make sure you have not developed neoplasm. Take plenty of fluids and come and see me again when you get your diagnosis reports. Track 2, questions 13 to 24. You hear a physician talking to a patient called Mr. Tulinsrue. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I find out what the problem is?
I've been experiencing the symptoms of heart failure for the past year, doctor. Although it appears okay in general, I feel a lot of stress and fatigue. I've also noticed shortness of breath with exertion. I am getting attacks of severe shortness of breath and coughing that usually occurs while I'm sleeping. I have developed edema and had a mild leg swelling a while ago.
Do you have severe chest pain called angina, palpitations, or syncope?
No, doctor, but I feel some irregularity in my pulse. Over the past 10 months, these symptoms have been gradually worsening. Over the past year, I've gained about 20 kilograms in weight, doctor.
What's your age?
63, doctor.
Have you had any previous illnesses?
I had right inguinal hernia surgery 7 years ago. I had trauma to my right thumb.
Do you have diabetes, mellitus, or heart murmur?
No, doctor.
Do you smoke or drink?
I don't smoke, but I drink.
Tell me about your family history. Any illness?
My mother's alive at 92. My father died at 76 of a heart attack.
Are you taking any medications?
Yes, doctor. Aspirin, 81 milligrams daily, and chlordiazepoxide and clidinium combination pill at 5 milligrams or 2.5 milligrams, 1 tablet daily for stress.
Are you allergic to any medicines?
No, doctor.
Okay, well, according to my comprehensive cardiovascular examination, your blood pressure is 120/70 in each arm seated. Your pulse is 80 beats per minute and regular. Your breathing is 2 times per minute, and that is unlabored. Lungs are clear to auscultation and percussion. The first and second heart sounds are normal. You have a fourth heart sound and a soft systolic murmur. The precordial impulse is enlarged. Your electrocardiogram shows sinus rhythm with left ventricle hypertrophy. Your peak oxygen consumption was 19.7 milliliters per kilogram of body mass per minute, which is consistent with mild cardiopulmonary disease. Laboratory data shows your thyroid stimulating hormone 1.33. Your glucose is 97 and creatine 0.9. Potassium is 4.3. I reviewed your echocardiogram thoroughly. That shows a dilated cardiomyopathy with ejection fraction of 15%. Your post-stress ejection fraction is 33%, and left ventricular cavity appears enlarged. This appears to be a newly diagnosed dilated cardiomyopathy of uncertain etiology and dyslipidemia. I'm going to prescribe angiotensin-converting enzyme inhibitor lisinopril 2.5 milligrams daily, and a beta blocker, carvedilol 3.125 milligrams twice daily. In addition, you could benefit from a loop diuretic, furosemide 20 milligram daily. I don't think you need a defibrillator right now, and after 3 months of medication, I want you to go on an echocardiogram. If your left ventricular function has not improved, then you would benefit from a prophylactic use of an implantable cardioverter defibrillator. So continue with these medications and meet me after a period of 3 months.
Thank you, doctor.